This program will show you how to assess an adult patient systematically from head to toe. To make the procedure as efficient as possible and to minimize position changes for your patient, we'll use a systematic approach that proceeds from one body region to the next in an orderly sequence. In this video, the patients have normal assessment findings, but remember, many of your patients may have abnormal findings. In these cases, always document your findings and refer the patient to a physician. Also, to avoid repetition, you'll see each test or technique performed on just one side of the patient's body. In practice, of course, you'll repeat it as needed on the opposite side. Start your assessment by taking a detailed health history to obtain subjective data. The information you gather during the interview will provide insight into the patient's actual or potential health problems and guide your physical assessment. To make the patient feel comfortable and respected, begin with open-ended questions.
What brings you into the office today?
Open-ended questions promote rapport, give the patient a chance to speak freely, and let him discuss the issues he's most concerned about. But when you want specific information, it's best to ask a direct question, such as one that requires a yes or no answer.
Do you smoke?
No.
Do you drink alcohol?
Also note the patient's level of consciousness, including his degree of wakefulness and orientation to person, place, and time. After obtaining the health history, ask the patient to empty his bladder and provide a urine specimen if needed, and then to undress completely and put on a gown. While the patient's changing into a gown, gather the equipment you'll need for the assessment. Then wash your hands. If your hands or the instruments are cold, warm them. Then consider your approach to the physical assessment. During the assessment, you'll use the 4 basic techniques: inspection, palpation, percussion, and auscultation. You'll also need to explain the assessment process and answer any questions, drape the patient, exposing only the area being examined, follow a logical assessment sequence, compare both sides of the body, and examine the skin throughout the exam, checking for lumps and nevi. After measuring the patient's height and weight, obtain his vital signs, beginning with temperature if needed. Remember to check the patient's radial pulse and respirations for 1 full minute. If the patient has a history of dizziness or fainting, check his orthostatic signs, blood pressure and pulse, in 3 positions: supine, sitting, and standing. To maintain standard precautions, remember to wear non-latex gloves when appropriate throughout the assessment, for instance, when you may be exposed to body fluids. Now you're ready to assess the patient's head and face. First, inspect the head and face. They should be normal in size, shape, symmetry, and contour. Look at the patient's hair and note its distribution, quantity, texture, and color. The hair should not be extremely dry or oily and should not contain scales or nits. Next, palpate the patient's scalp, which should be pink, mobile, and free of lesions. You may feel bony prominences in the forehead, in the sides of the parietal bones, and behind the ears. These are normal. Using the tips of your middle and index fingers, palpate the temporal arteries. Their pulsations should feel equal. Listen for bruits over the temporal arteries. You should not hear any. Next, press your thumbs under the inner aspect of the orbits to palpate the frontal sinuses, and press under the zygomatic bones to palpate the maxillary sinuses. Then lightly percuss these areas. Palpating and percussing the sinuses should not cause pain or tenderness. If they do, assess the sinuses further with transillumination. Move your fingers to the patient's temporomandibular joints. As you palpate with your middle fingers, instruct the patient to open and close his mouth. The joints should move freely and painlessly. This technique assesses joint mobility and the motor function of the trigeminal nerve. To test the facial muscles and the motor portion of the facial and trigeminal nerves, have the patient raise and lower his eyebrows, bare his teeth,
Give me a big
smile broadly, puff out his cheeks,
Now I'd like you to keep your mouth
and keep
shut
his
while
mouth
you're trying
closed as you try to open it. All of these movements should be symmetrical. If the patient reported problems with his sense of taste during the health history interview, test the sensory portion of the facial nerve by having him identify sweet, sour, bitter, and salty substances.
Salt.
To assess the sensory portion of the trigeminal nerve, test the patient's ability to identify simple touch. Instruct him to close his eyes and to tell you the moment he feels something touching his skin. Check for simple touch sensations on both sides of the patient's forehead, cheeks, and jaw. The patient should feel the sensations equally on either side of his face. Now move on to the eyes. First, test the patient's visual acuity with a Snellen eye chart. If he normally wears corrective lenses, he may wear them during this part of the eye exam. With the patient standing 20 feet from the eye chart, instruct him to keep both eyes open, cover one with a card, and read aloud the smallest line of type on which he can read more than half the letters.
DEF, POT, EC.
Note this line's numerator, 20. This is the patient's distance from the chart. Also note its denominator, which is the distance at which a patient with normal vision can read the line. The larger the denominator, the poorer the patient's vision. Normal vision is 20/20. Record the patient's vision for each eye and note whether he was wearing corrective lenses. Now inspect the patient's eyes and external eye structures. The eyes should appear symmetrical and the eyebrows should be free of scaling. The upper eyelids should partially cover the iris and the eyelashes should turn outward. Now test the oculomotor nerve by asking the patient to close his eyes. The eyelids should move symmetrically without tremors. Gently palpate the eyelids for nodules or tenderness. Then ask the patient to open his eyes and look up as you invert the lower lid to inspect the lower conjunctiva. Then have the patient look down as you pull up on his eyelid to inspect the upper conjunctiva and sclera. The conjunctiva should be pink and free of exudate. The sclera should be white. Palpate the lacrimal apparatus by gently pressing below the orbit. Pressure here should not produce exudate or excessive tearing. Next, you'll check the patient's extraocular movements to assess the extraocular muscles and innervation of the oculomotor, trochlear, and abducens nerves. Place your finger 12 inches from the patient's eyes. Instruct him to watch your finger as it moves to the upper right, far right, lower right, lower left, far left, and upper left. The eyes should move together equally and smoothly through these 6 cardinal positions of gaze. In the lateral position of gaze, they should show 1 or 2 beats of nystagmus, a fine oscillating movement that's abnormal in other positions. To test accommodation, hold your finger 4